control right now. I hate cords on the ground. We hate running. Cords are our nemesis in ultrasound. So these always have little hangers. Hang them up. I don't want to see. If you're scanning and it's fine, it's kind of touching the ground. But when you're done with your station, making sure that those are off the ground. Additionally, out in the real world, we wouldn't hand our patient a probe and have them hold on to it. So if a probe's not in your hand, it's on the machine. If you drop these, there's a line of what we call PZT crystals in here. If you drop it and they break, the probe is done. It's absolutely broken. We cannot use it. I have to go beg the budget committee. I have to cry. Probably have to take somebody out on a date or something. But they're very expensive and we don't have a lot of big budgets. So just making sure that you're taking care of that. When you're done scanning, you're going to use the wipes on the back of the machine. You're going to clean your probe off. Some of these have like a little bit of texture, so you just want to make sure that you're cleaning out all the little nooks and crannies. And then I clean all the way up the cord. The probe touches the patient, also the cord does. And so you just want to make sure, especially like with transvaginals, you just want to make sure that I clean all the way up the cord. All of my little cordies get hung up. Oopsies, hey, get there. And then just doing you don't have to get crazy on this, but just doing a little bit of a wipe down. Out in the real world, we get a little bit more crazy because we're dealing with maybe bodily fluids, blood, things like that. But just making sure that things are kind of clean. And printer-wise, we'll touch base on printers next week. We won't worry too much about that, but you can use the same wipes on the gurney and you just kind of wipe it from head to tail. The other thing, I'm an absolute, this is because not even COVID, I've worked with livestock my entire life, hand washing. Hand washing, hand washing. So there's a sink in the back, there's a sink here, there's two in the restroom, there's two restrooms out here. I expect you to wash your hands before and after scanning every patient. That's just the way the world works. Out in the real world, I don't use the gel. I'll actually wash my hands in front of my patients as I'm asking them patient history questions. So it's a good habit to get into. And it's gonna, like, the minute you don't do it, it's like wearing a seatbelt. I was like, you know, when you get in the car and you forget your seatbelt, you're like, oh, something's wrong. So it's gonna be like that. If you don't wash your hands, what's wrong? So making sure you're doing hand washing. And that's, you know, COVID as well, but that's just part of flu season coming up, grody germs everywhere, things like that.
Do we need to should we wear gloves all the time here?
So when I scan, so you're gonna scan with one glove on your scanning hand. I don't like to type with so like out in the real world now, I have to wear a full gown, 2 gloves, an N95, a face shield. So I'm like gloved up, you know, PPE'd up, and I don't like it. But the only time I wear 2 gloves is when I'm out, you know, pre-COVID, is when I'm doing procedures and when I'm doing a scrotal exam. Because scrotals, I sometimes have to kind of arrange things. Mm-hmm, but I don't like typing with a glove on. Mm-hmm. So I usually just a scan hand.
Mm-hmm. And here we have to wear glove too.
No, just the sonographer. Okay. Oops, what am I doing? Okay, so is it button time? Do you guys have any questions?
Oh, because I used to work in daycare and they train us every month about fire alarms and shoot. Like, what do we need? I see just
run away.